This program features interviews covering subjects that some listeners may find triggering. Topics that could be discussed include suicide, self-harm, drug addiction, mental illness, domestic violence, and gang violence. Opinions expressed here on the Why You Crying Fu podcast do not represent Reshaping Identity, 805, or any supporting organizations. This program is made possible and part of the state-funded California Creative Corps through a grant awarded by the California Arts Council and administered locally by the Ventura County Arts Council.
Hello, I'm Fernando Albert Salinas here on the Why Are You Crying Fool podcast, and I'm here with Laura Espinosa. Before I go ahead and open it up to you, I'm going to read this bio. I think one thing that happens in our community is that we spend so much time investing our lives into making everyone else's lives better, and then people forget all the things we've done, and sometimes we even forget. We have to be reminded. So I'm going to read you the list that I have, and we'll go from there. Ms. Espinosa holds a Juris Doctorate degree from Ventura College of Law and has served in other capacities within the organization. I believe you're currently serving your second term as president for the Santa Paula Latino Town Hall. Most recently, you were honored by the Santa Paula Chamber of Commerce for your community organizing work to reopen the obstetric unit of the Santa Paula Hospital. Let's see, you're also an advocate for converting the Ventura Community College East Campus to a college center in the Santa Clara Valley. And I know that's been years and maybe a decade of work. We could talk about that if you'd like. You were very active in COVID relief efforts. You're a board member for the Gold Coast Health Plan, a member of the Latino Consortium, working towards equity for Latinos and better services in Ventura County. And you were also the first elected Latina in Ventura County, city of Santa Paula.
Well, thank you for that introduction. I always want to start with the community, and because that's where my heart is. And so when you have identified a few projects that the community really has been involved in, I'm a part of that. And some of those, yes, I have led some of those efforts, but definitely these are long-term projects that take a lot of community activism to fulfill, and some of them still are not completely fulfilled after decades of working on them. So thank you for the introduction, and
Absolutely.
I appreciate that.
What did I miss? Tell me more.
Well, I'll just say I was born and raised in Oxnard. This is my hometown. And then I met my husband at Ventura College, Victor Espinosa, and we made our home in Santa Paula. So that was in 1974. So really, Santa Paula now, after 50 years, is my home. When we first got married, I asked my husband, well, who are the people that are working on campaigns and political things? Because I knew from a young age that policy is made by elected officials, and that is what changes institutions. Yes, when I grew up, my father was very involved. He was a labor leader, and so I got an early view of what politics can do. And I don't mean politics in a negative. It's actually a very positive word. And so I, as part of my family, went with my dad oftentimes to Sacramento when he was conducting business. So I saw firsthand what elected officials do. That was my introduction. Also, just nearby this location where we're filming this, on Vineyard Avenue, there was a strike going on. And so that's where I learned you never cross a picket line. So those kind of political inspirations really helped develop me and my way of thinking, my perspective about about advocacy for working people. Later, I became an elected city councilwoman, the first Latina in the county to be elected as a Latina, as a woman in Santa Paula, and I served 2 terms there. I'm really proud of that work because that was our first battle for affordable housing. And since then, we have several beautiful affordable housing complexes in Santa Paula. It was really a very difficult and very charged atmosphere during that time because it's not like today. You know, we're now in 2024 and everyone is impacted by high rents or mortgages. At that time, it was, you really had to have the community behind you to persuade the other elected members of the council that affordable housing was needed. Maybe they themselves didn't need it, but the constituents that they represented needed it. And so today we have the Rodney Fernandez Gardens, we have Casa Garcia. That was the very first one. Only 14 units, and you would have thought the sky was falling. As one woman told me, very nice Anglo lady said, Laura, you were like red meat. And the city council chambers were packed. They were angry. And I like to say this because I do credit my faith and my parents' upbringing in setting the foundation. So I always took my rosary in my pocket. I'm Catholic. And when things got a little rough, I would just, put my hand and rub my rosary. And it just, gave me strength. And, I said, yeah, this is the right thing to do. So I always went prepared. And I tell young people now, if you're going to do advocacy work, you got to be prepared. Don't just think you can walk in there and because you're emotional and you feel that it's a good issue to get involved in, that you can do it because they're going to eat you alive. So I always made sure that I was well prepared in any meeting that I went to. And that's also why I went back to college and got my Juris Doctorate degree, because I wanted to be the most effective leader that I could be. And I thought with that strong educational background, I could do that. So fast forward a little bit, I was asked to be on the board of Clínicas del Camino Real. And I'm really proud of that time of service that I had. Here's a book, The History of Clínicas. And this was written by Dr. Jaime Casillas. It really is an excellent, you can see it's not overly large, but it really gives a history of healthcare access in Ventura County. So, the county of Ventura is the safety net for healthcare for low-income people in Ventura County. However, there were still segments of our community that were not being served, mainly farm workers and Latinos. So by having the organization of Clínicas del Camino Real establish in Santa Paula their first clinic, it allowed access to healthcare that was not there before or was there in very limited ways.
Was there resistance to the Clinica being developed, just in the same ways that there was for the housing, or?
Because I wasn't there in Santa Paula yet when it was first established, I don't know what the atmosphere was, but over the years, definitely there was this competition for that population to be served. Clínicas is a federally subsidized health clinic. The county also gets the same federal dollars for serving. So oftentimes the county, though, had opportunities for grants. They would deny Clínicas those opportunities. So really, it was the direction, the administration of Roberto Juarez and his staff that built that institution, which today I believe has 13 clinics throughout the county and continues to serve the farm worker population and other populations. I served on the board, I believe it was about 10 years, and then I left to pursue some other similar opportunities. So I tried to use my position as an elected to establish policies that really it was working class and individuals that were of lesser income means, and that would have been in housing, education, healthcare. I was one of the original founders of Santa Paula Latino Town Hall, and that's been, I believe, in 2006 that we founded that organization. And it really it was because it was to give a voice to the community. We were fighting for affordable housing. People felt that their voice wasn't being heard, so we established this organization. So Town Hall represents people being able to speak.
Right.
And so we have a long track record of advocacy. And I tell people when I speak, for example, last year I was one of the guest speakers at the METRA conference at Ventura College. And I tell people, sometimes people just have a good heart and they just want to help in the community. And we need it all. So if you want to be involved in a charitable organization, you want to help the Boys and Girls Club, you want to do food share, or you want to do Boys and Girls Club, Scouts, or your church that you want to volunteer with, all of that is good, and we need it all. But if you really want to make institutional change, civil rights and advocacy is the way to go. And unfortunately, it's also a slow process, and it can take years and decades to accomplish what you think will take, only a couple of meetings to fix this issue or that problem. And in reality, it's much more complex. And so you really have to have that commitment within you that I'm going to see this through. So I would like at this point in my life to see a younger generation have that commitment. And like my husband says, well, not everyone's going to be a Laura. And that's true. That's true. But everyone can make a difference, even a small effort. So I've been involved in several nonprofits. I mentioned Clinicas. I've been involved with Boys and Girls Club as well. My husband became president of the Boys and Girls Club board. And when you're active in your community, if you have a partner, a spouse, they kind of get involved too. So I became involved in the Boys and Girls Club. My children were small. It kind of made sense. And we were both making a contribution there. And then I started working for the County of Ventura, and I worked in the district attorney's office. And I had this dream that I would get my law degree and I would make a difference in the district attorney's office. But I learned after years of service there was kind of a different philosophy than what I came from. And probably a better fit would have been in the public defender's office. However, none of that occurred. And so I used my degree to be on the city council. And my thought was, well, we'll start at city council. And a funny story about that, when I was looking into being involved politically, I had called a friend of ours. I had asked my husband, well, who does campaigns and political stuff in Santa Paula? And he told me Jesse Ornelas. And so I called Jesse and I said, Jesse, I'd like to get involved in voter registration and helping a campaign. and maybe running for office myself. And he said, "Oh, great, school board?" And I said, "No, city council." And and not that there's anything wrong with school board, because that is usually the trajectory. Someone may run for school board and then they may decide they want to run for a different office. But I already had in my mind it was going to be city council, and then who knows what else. So we did that, and I was elected in 1994, and it was the year of the woman. So that was kind of monumental. And in the meantime, I was working full time. I was going to school, raising 3 children with my husband, and being a wife, mother. It was, that's what you do when you're younger. You can do it all, So I had that mindset. Yeah, I can do this. And thankfully, I had a very supportive spouse. When I worked for the county, I was a union steward. I had been sent to this training in Los Angeles. And this is the why I do what I do. The week before, there were workers, they were they cleaned the high-rise offices in the middle of the night, kind of the invisible people, using probably chemicals that are unsafe. And there was a march that they did the week before I got there, and it was down Wilshire Boulevard, where all these corporate offices are, and some of the workers worked at Mattel Toy Company. And the police got a little crazy, and one of the women, a Latino cleaning lady, janitorial worker, got beat with a billy club. And when I got there the following week for my training, I was told that she lost her baby. So that greatly affected me because she was Latina, she was female, she was a mom or going to be a mom. And so I took that very personally, and I said, wow, but for other circumstances, that could have been me, So I was really committed to working for working families. That convinced me right there. It was the best example and experience that I could have had. And I wish that other people could have that kind of experience so that their commitment can be as strong, I think, as mine. And so that's my 1 minute of why I do what I do for working families.
So you said that was kind of, I always look for this thing that starts the fire in our lives and gets us going and just keeps us going. And that was one experience that you had that committed you. But because you've had a long journey in advocacy and working for the community, I imagine that there's times when you feel burnout, when you feel as though, hey, I've had enough, I'm tired of getting up and doing this day after day. What keeps remotivating you?
Again, I think I go back to the foundation, and I realize that maybe other people didn't have the same foundation as me, and so they're not going to have that drive or that fire. But perhaps they've had other type of personal experience. What motivates me are my family and my larger, broader family in the community, and I see the needs that are there. But I don't want to focus on the needs because I think we need to be an asset-based community. So many people just talk about, those poor people over there in the Santa Clara Valley or in South Oxnard, and as if they're not bringing any assets to the table, when in fact they are very much so by their work, their labor in our community, the fact that they're raising families that can be thriving families. But all of us struggle in one way or another, and that's why I think I'm drawn to healthcare access, because For example, mental health services, until there was the push from advocates and clinics like Clinicas pushing the county to provide and improve their services and have better access, that may not have happened. So I think that when we struggle, we need to seek help. And I am a strong believer in therapy, if talk therapy, medication, seeking medical care for your struggles. It may be short term, it could be long term, but I think it enhances our lives to be healthy. And mental health services are just like any other kind of physical medical care that one requires, from infancy to our elder ages. So my family has partaken in counseling and other services. I first had a personal experience when my son went to college, and he really struggled emotionally. And, I was really adamant that he get care. He didn't want to get care because male, young man, that's not usually the population that, at least at that time, this has been many years ago, that would seek mental health care. And so my husband and I helped direct him in that direction, and thankfully, that worked out. I thought I was going to lose my son, so there is no way, as a mother, I was going to allow that to happen. So he's a thriving individual now. He's a deep thinker. I just can't say enough about him. Very kind-hearted, and now he'll face other struggles, maybe not emotional health struggles, but other struggles. And
At that time when you were going through that, was access to mental health services available? Was it everywhere? Was it something that kind of gave you a new fire? Said, hey, we need to make this more available to more people or make it easier. I mean, there was a time when, I don't know how many years ago, but I know that maybe one time I wanted to see a therapist and they said they could see me in 6 months. And that was too long.
yeah, I think fortunately, both my husband and I had good paying jobs where we both had health care. So it wasn't because he didn't have health care, health insurance, I should say. And to be honest with you, I don't recall how we went about getting the services he needed. I know it wasn't on his college campus. It was private care. I wish I could remember that. I think I was just so happy that he found care and that he was doing better. So, yeah, I'm trying to think. It wasn't an access issue for him at the time. Yeah, but so many people now, yes. And we all know, because the data has shown that COVID, excuse me, COVID really did a number on our young people. And there are not enough therapists, professional in the nation. There's a shortage of these, especially that are bilingual or bicultural. So in that sense, there is already an access problem. But then what are the barriers once you do go to a provider? And for many in our Latino population, that their first area would be either Clínicas del Camino Real or the County of Ventura. So because of the organization Santa Paula Latino Town Hall, we made mental health services one of our missions and healthcare access. So we try to combine issues as well. So for example, the Ventura Community College District, we try to put partners together so that there's training and then there's the actual care. Right now, we've been working on expanding the community college to the Santa Clara Valley and having a full-service center. There's a piece of property on the 126 freeway in Santa Paula where the county hospital is going to put their new hospital within probably an 8-year period, if all goes well. And there's room on that property to have a college center.
Wow.
And that would be excellent because there would be direct training for not only the current hospital workers who could be taking additional training for promotional opportunities, but also for those entering the medical field. And one of the issues that, one of the areas that we have asked Ventura College to provide is mental health coordinator position training. And so we're hopeful that that will be one of their areas that they will strategically establish on that campus. And it would all be on one campus, the college and the hospital. That's our dream. We have yet to convince the college district to purchase a property now because Santa Paula, for example, is built out. There are very few large parcels of land that can be purchased for something like that. So we've been going to every board of trustee meeting and trying to persuade them that was a promise they made. We passed a bond measure in 2002 to establish a center in the Santa Clara Valley, and they have not fulfilled that promise, and yet all of the taxpayers continue to pay on that. What happened, and this is really such a horrific story for the community, and it also speaks to the fact that Latinos are not, if you don't have the right policy makers, decision makers, this is a perfect example of things going wrong. So while we passed a $350,000 bond measure, the college center, 22 years have passed and they never built it. But where some of that money went to, we have no objection to them, of course, improving all the other 3 college campuses. And they did that. We kind of laugh about it, funny but not funny, that they built this beautiful track at Ventura College. Okay, so on that campus, but they didn't get to building the center in the Santa Clara Valley. So for generations now, at least 2 generations, students were denied access to higher education because the Santa Clara Valley is rural. It doesn't have the transportation availability. And so those students probably got part-time jobs someplace, maybe got lower level jobs that, whereas had they had the access, they could have been thriving individuals contributing to the economy. And so we know that economics and education go hand in hand. And so when they talk about the Santa Clara Valley and, oh, that poor community over there, well, that poor community was intentionally left poor, whereas we could have lifted ourselves up had we had the college experience for our younger generation of people. So getting back to this connection with healthcare access, so that money that was spent on the bond measure to improve the other college campuses, but a large portion of that money went to establish a sheriff academy. That is a county function. That was not a college district function. But again, we had elected officials that were
Is that called
working-
an agenda?
They had
their own agendas?
they had a different agenda. They were supposed to be representing us, and yet they were making these deals that the public was not aware of, and I still believe that that was an illegal act because that was not a function of the college district to build the county sheriff academy. And, you know, today we see that crime is actually down. It was just a bad situation all the way around. And so what I say is, well, can we go ask the county to give back the district the money that they use for that academy so we can get our center done? Interesting thing about this, now the college district in 2024 is considering a bond measure, $1 billion bond measure. They call it 990,000 or 990 million, so it doesn't freak out people, but it is $1 billion. And no mention of the college in the Santa Clara Valley. It's generic repairs. And so we're going to be asked to support another bond measure after we already really, you know, I don't have the term for it, but basically we got ripped off. And so, we'll see where that goes. I'd like to talk, if you don't mind, a little bit about Gold Coast Health Plan. I'm an appointed commissioner on the Gold Coast Health Plan, and that is really an important part of our healthcare access. We serve 240,000 Medi-Cal eligible individuals. And that's not everyone, because now the law has changed to allow more access to those that formerly were not eligible. So first it started with undocumented children, and then it was another age group of 18-year-olds to 24. And now in California, I'm proud to say that we want our populations, all of them, to be healthy. And so all of them have access. It's income eligible access. That's what Medi-Cal serves. You have to have a certain income. And so Gold Coast is the county agency that manages all the Medi-Cal clients in the county of Ventura. This year, we have dedicated $75 million to go for incentives to providers to provide quality care. So if that means hiring another doctor in your facility, that money could be used for that. There's also funds for medical equipment. So maybe there's optometry or gynecological equipment that are needed to serve women or people with vision problems. That money is available to them for equipment. So Gold Coast, we have new administration there. They're very focused on serving the population and providing quality care and ensuring, because they have oversight over the providers. So they have to tell the state, we are ensuring that the Medi-Cal recipients are receiving not just good care, but excellent care. And the state, through a program called CalAIM, this is a new way of servicing the clients, the members of Gold Coast. They must meet certain measurements. And if they don't meet those measurements, they will be heavily, heavily financially sanctioned. So there's an incentive to provide good quality care in our community.
Are people, are people aware that they can see a dentist, get their glasses done? I mean, all the things that I'm thinking of Clínicas specifically, I know that they provide so many services. When you say, I don't know how many people are in our county, but 240,000 are members of Gold Coast. And are those people actively using?
So that's part of the outreach efforts that Gold Coast does. And oftentimes you see health fairs at, food distributions, things like that, or community events. That's how the word gets out. But and there are about 900,000 population in Ventura County. I do know that. But of that, 240,000 are members. And then there are others that have not signed up yet. And so that's why the importance of outreach. The County of Ventura, they also do outreach. To be eligible, it has to be determined by, for example, workers at the Human Services Agency of the County of Ventura. They have to be certified workers that determine eligibility. So it's not like you and I could go up and set up a table and enroll everybody that we wanted to enroll. They have to be certified eligibility workers to do that. Outreach is really important.
I would say since October, I've attended and participated in at least 16, maybe 17 events, and I've seen Gold Coast. I've seen a lot of services being offered to people, food being distributed, and I don't know, this people are excited about being provided opportunities like this, and they get in long lines if they need to, whether it's for a little bit of information or for a bag of food. There's a lot of need in the community, but I see continuous support for the community and the community working together to support each other. And I leave these events feeling really good.
Yeah, I know at Oxnard College, they have the monthly swap meet, and they have all kinds of services, whether it's legal or healthcare information, blood pressure screenings. There are certain areas that the state would like us to improve, meaning those in healthcare, to improve quality, not only quality, but the numbers. For example, for women, it's chlamydia screenings. For children, they're well visits when they're first born through the age of 18 months and through age of 5, making sure that moms know to take your children for those services. And that's a way to do mammograms for women, to do preventive care. Preventive care is always best because you're not waiting till you're already so severely ill that it is more costly. So that's where we really want to target. Blood pressure screenings are really important because that will determine whether you may have some hypertension or heart issues. Diabetes in the Latino community is very prevalent, so blood sugar screenings are very important. Reminding people who are on blood pressure medication to get your refills, and that I know I have a family member that I have to remind him, did you get your medication yet? Did you go for your refill? Well, that means I have to get on the bus. Well, you got to get on the bus. You can't, people often put everyone first and they don't put their own health first. And myself as a caregiver for my spouse, for my 2 brothers, I have to remind myself because I have to stay healthy to provide care for the other ones. And that really worries me because I'm like, oh my gosh, who is going to take care of them? Because, I take care of appointments, I'm the driver. There are different things that caregivers know that they have to be responsible for. And if I'm sick, that it really, and it's usually the female in the family. There are male caregivers, of course, in families, but predominantly women are the caregivers in the family. So stay healthy.
They probably already exist, but just hearing you say that, it makes me wonder if we should create a class or kind of like a workshop where we can teach the community how to be caregivers to the people in their family. Because it sounds like a full-time job. making the appointments, making sure they have the medication, making sure they eat before they take their medication, making sure that everybody's getting enough sleep and all of those things. It's a
Yeah,
lot
I
of
think
work.
we need more support for caregivers, and just my nature, I'm one of those, if I need help, I'll ask you. But will I really ask? Because I'm like, no, I'll just take care of it, And we have to remind ourselves it's okay to ask for help. And, fortunately, I have my immediate family, and if I ever needed help, and I always tell them, that if I need help, I'm going to ask you. And at that point, that means I really need help. So I try not to burden other people, I guess, but I will ask for help if I need it. And I'm one of those ones. But there are people that have no family. My neighbor across the street, elderly woman, she fell in her home, and she laid there for 2 days.
Wow.
It was. Yeah, and we are neighborly. We all try to check on each other, but that particular day, there was packages on her porch, and both my next door neighbor and myself, we saw the packages, and we made a mental note. We better call Mrs. So and so because maybe there's a reason. Maybe she just can't pick up the packages. Little did we know, no, she had fallen and she laid there, and thankfully she's okay now. She moved back to her home state where she does have family. So, but I think support for caregivers is really important. Yeah, one thing I want to mention, my profession, I was a union organizer and negotiator, and I worked for one of the largest unions in the country, but here in Ventura County. So I represented city and county employees, and very middle class. They have access health benefits, so they could see a doctor. But how it impacts even the economy if if you don't have emotional and mental support is that oftentimes I represented workers who were being disciplined for something. And these would be workers who had worked for the county or the city for 10, 20 years. They were good workers. They always had good performance reviews. And then something happened in their life. And so I really made it a point to get deeper into the story if they wish to share it, because good workers do not just become bad workers. And so I made that distinction when I was representing them because usually it was, I'm going through a divorce, I'm now a caregiver for my elderly parents, and all of that stress then it stays with you and goes back to the job with you. And you can't be that 100%, 120% person all the time. I mean, there are stressors in life, and you need to take care of those. So that was I kind of felt that was part of my caregiving role as a union organizer, is to make sure that the member knew, seek some care. Find yourself a therapist that because you need it right now, and it's important that you, again, you're the bread and butter of your family. You need to keep yourself healthy, and you're about to lose your job. So, and then it took the negotiation and the persuasion with county management or city management to let them see this is why we have medical time off, not only your sick time, but there's also leave of absences available to you. And this worker should not be dinged, basically, for either accessing their health benefits or their legally mandated time off if they so desire. And I would say most of the time that worked really well. And the employee was better off because of it. They were healthier. They still had their job. But I remind people, good employees do not become bad employees. So, yeah, hopefully it impacted many of the employees that I worked with.
It seems like common sense, but so often we forget that if we're unhealthy mentally, then it impacts us physically. And if we're unhealthy physically, it impacts us mentally. And when either our mind or our body are not well, it impacts the rest of our world. And work, if you lose your job, I mean, that'll just, all the things that come along with that create more stress and more problems. It's awesome that you're able to advocate for workers.
Yeah, I loved my job, and I think it was important work. Yeah, happy to do it. And some of those members are still, they seek me out, or we, may have lunch together and we reminisce about the good times and the bad times.
That's really nice. I don't remember who I think I was speaking with Bill Terrajas, and I asked. He's an educator, and he did his best to impact the community in a positive way. And I like asking, do you have those people that reach out to you, not just to thank you, but because you changed their life, and now they become a part of your life, or you've become a part of their life, and you just told me that they do reach out to you, and that's nice. Because that one-on-one, just that meal with somebody that you've worked with and for, it's a great reward. A lot of the work that's done for the community is not financially reciprocated in any way, but we're kind of rewarded in our spirit, in the way we feel.
And I think it's important to acknowledge all the volunteers in the community, because there is no financial reward. The reward you get is just within yourself, and, those comments that maybe are made to you, thanking you. But there's a whole world out there that is not acknowledged, and they should be acknowledged. The volunteerism in this county is really very positive. I know South Oxnard in particular has an enormous group of people that help with food distribution and other things. Same thing in small communities like Santa Paula, Fillmore, Piru. We do pull together, but wouldn't it be great if we could prevent those kinds of things to begin with? And maybe that's just going to take more time.
So who do you recommend, people that want to volunteer? What are top 3 organizations that you would recommend?
Well, I'm going to put a plug in for Santa Paula Latino Town
go.
Hall. I think it's a great organization. We have a long track record. And, there's a wealth of activities that you can participate in. Maybe you don't want to dedicate your entire life to it, but maybe in this year you want to help with a youth conference, or maybe this year we're looking at more town hall meetings in Santa Paula, because we notice that we're so busy in our lives that we forget what's going on in the community. And then that's why you have all the weedy on Facebook, because people really do not know what's going on in their community. And I find that amazing, because, it's a small town. What do you mean you don't know what's going on? What do you mean you don't know that there's an important meeting at the city council? But they don't. And, so I would like to see more volunteers helping with town hall informational meetings. Our executive board just talked about some of the issues we would like to talk about in these town halls. Some are more about civic engagement, because again, it's about the policymakers, and we may not endorse candidates, but we want to work to get people more involved in their community in the civic arena. So that could be voter registration, that could be candidates forums. And one of the other ones was a topic on human trafficking. Hadn't thought about that myself, but one of the members who's an educator. She thought that that would be a really important one because of her student population that she works with and their parents. We definitely want to continue our advocacy work on the new hospital and the services that will be provided, including mental health. We have a monthly meeting with Ventura County Behavior Health where we meet with Barry Zimmerman, the director of the healthcare agency, and the director of behavior health. Interim director is Dr. Dennering. And those are important discussions to have because we provide feedback directly from the community. You know, while they're providing services at the administrative level, they're not in the community. We recently had a very good director that did take the time to be in the community, but unfortunately he's gone now. And that particular agency, Behavior Health, has had a big turnover of administrators and directors. And so every time that happens, we have to start from square one again, explaining to them what the problem is. I mean, things as simple as having linguistic and culturally competent providers. I mean, we're in 2024. I remember talking about that in the 1970s. So how can we still be talking about this? It's because there's a turnover of administrators that may not be aware, may not have that cultural experience in a job they held before. Maybe they were from out of state. But, you know, so those kinds of things. We have many opportunities for volunteers. So I can only speak for my own community. So I'm sure in Oxnard, there's others, Ventura. When we do go with Ventura Behavior Health, Ventura County Behavior Health, we always advocate for those areas where we know there's a high Latino population. I mean, we are Santa Paula Latino Town Hall, but we're concerned about services for Latinos everywhere. So it may be the Avenue of Ventura where we've been pushing for a site there to provide mental health services right on the avenue. South Oxnard, we go by zip codes. So we have advocated for the 93030, the 933, the 93060, 93015, Fillmore. I mean, you know where the population and where the needs are. We've been doing this long enough where our group that advocates for this knows this. So we have had some success over the years, but I really think that the county in particular could do better. Yeah. So.
Well, it seems like if you look from when you first started to now, I'm sure you've seen that the community, the county has made major improvements. And even looking at some of the numbers of services being provided to Latinos in the county, the numbers have gone up slowly, and the numbers aren't perfect, but there are improvements being made.
Yeah, I want to acknowledge that. You're right. There are improvements, and yes, they could be better, but you know, Latinos are 44% of the population according to the last census. And so, for example, the hirings that are done, they need to represent the population that they serve. And for the county, for example, there's 27 departments and agencies within the county. 2 of them, and they're the 2 smallest, that would be the public defender and public health, have Latinos as their directors. The other 25 do not. So again, we've been talking about that with county administrators for decades. And so I myself feel that that would be a critical part of enhancing the access to services, the delivery of those services, the policies that they make, for example, even with their own employees, training. Yeah, you can have all the training and mentoring programs within the county structure, but if you don't have the administrators who will implement those and take it seriously, it's not going to happen.
Right.
So I'm really a big advocate for, especially right now, the county has multiple vacancies at the higher levels. As Latinos, we're very well represented at the lower end of the ladder, let me tell you. But at the higher end, again, 2 directors out of 27 agencies. That speaks volumes. And I know we've had these discussions with the county administrator, CEO, and board of supervisors in the past. So we just need to keep pushing on that. Change will happen. It will happen. It just takes a while. And some of us are reaching our maximum effectiveness age-wise. So we'd like to take a little time to retire and enjoy the good life too. One, we need people in positions, decision-making positions, because none of this will happen without that. Yes, we need the services and training, such as mental health is really still very, very important, and especially because there's a shortage. So how do we make the shortage? I mean, we've got colleges, universities here in Ventura County, and many people have mentioned this already. Where's the pathway? You know, do you have some partnerships so that those people that provide the services can be trained and we can have a quick access to them as soon as they're ready, you know, they've graduated, maybe they're serving an internship, and then looking at different ways that will incentivize, is that a word? Incentivize? Provide incentives to those newly trained individuals to serve in Ventura County. So I think the healthcare access and the higher education access, they have to have that. Without those 2 things, we will not only not be economically healthy, we just won't be fully productive as a county, as a county family, I guess.
So I guess I'm going to ask you my closing question. And I guess in many ways you've already answered these questions because I see the work that you're doing. But now something's going to happen. It's going to give you all the financial resources, all the manpower, the people power that you need. What is that one thing, not just in our county, but in the whole world, that you would want to change and to make this world a better place?
Wow, if I had that magic wand, you know, I think it's kind of a cliche to be kinder to everyone. But really giving a little bit more of ourselves does not take a lot. And I think we could be very effective if everyone just gave a little bit more of themselves, even one day. I mean, it would make an amazing difference. You know? But hopefully you're committed to do it, you know, for the rest of our lives. You know, always be serving our community. In the Latino culture, you know, I think it's, I take it as a given that our family means our community too. And I don't think in an Anglo community that's necessarily at their top of mind. You know, there are many, many good people in our county, and I really appreciate the allies, those that do volunteer in the community. But are we bringing up other people? So, you know, and are we contributing for the right reason? Is it to make ourselves feel good, or are we really doing it to uplift our community? We should always be looking behind us. Is there someone else that we can help? And I definitely want someone to replace me. So I feel optimistic, I guess is what I want to say. Even though there are these needs, I always remind myself, no, we have to think in terms of assets, that we bring something to the conversation. We bring something to the table, that we are solution driven, you know, and, you know, it's hard because you have to state what I feel is the obvious. Yeah, there are needs in our community, but you also have to state that, but they bring assets too. So I think more people and more classrooms should be doing this on the board, you know, okay, here are some needs, but what are the assets? You know, I think it changes your perspective of how you address not only community issues, but everything in your daily life. So.
I really appreciate you being here, and I thank you for
thank
your
you.
time. Words of wisdom. It's
Thank
great
you
to see you in the
for-
community and doing so much, and I know everybody needs a break sometimes, so hopefully we train. You've set the example. You've been a model for others that can hopefully rise up to the challenge.
I hope so. I feel optimistic about our youth. We have differences and different approaches to things, but there's always going to be those people that want to give. So I look forward to seeing the new generation coming up.
Me too.
If you or someone you know is experiencing suicidal thoughts, please call the Suicide Prevention Lifeline at 800-273-8255. For victims of child abuse, domestic violence, or sexual assault, you can get help at the Safe Harbor inside the Family Justice Center by calling 805-652-7655. All services are free of charge and confidential. Addiction is treatable. Recovery from drug and alcohol problems start with a call or an email. For Ventura County Behavioral Health Substance Use Treatment Access Line, call 844-385-9200 or email sudservicesventura.org.